mynews.studio.
A 14-year-old has built an AI app that can scan your heart in just 7 seconds. The question is, could this simple test end up saving millions of lives?
The date is June 3rd, 2025. Let's dive straight in. Cardiovascular disease is still the leading cause of death worldwide, but something unusual is happening. Out of Dallas, a teenager, Siddharth Nandiala, has launched Circadian AI. It's an app claiming to detect heart disease in 7 seconds, and it reports over 96% accuracy. Do we know how this actually works?
Yes, the process is actually pretty simple. You hold your phone near your chest. The app records your heart sounds for 7 seconds and then uploads the audio to the cloud for analysis by machine learning. In just a few seconds, you get a result, either normal or showing an abnormality. But the key thing here is early detection, especially for people with no symptoms, who might never get a formal test.
That's crucial. Traditional diagnostics, like ECGs, stress tests, or echocardiograms, are expensive and need trained specialists. This could make screening possible with just a smartphone. But how solid is the evidence? What kind of clinical trials are backing this up?
The trials are pretty robust. The app's been tested on roughly 15,000 patients in the US and another 3,500 in India. At a hospital in Guntur, India, for example, it screened hundreds of people. In one study, it identified 10 out of 505 patients. In another, 16 out of 863. All those cases were later confirmed by standard medical tests. The overall accuracy is reported at more than 96%.
That's a significant result, especially for something created by a 14-year-old. And Nandiala isn't just any coder. He's the youngest AI-certified professional globally, with certifications from Oracle and ARM, and he's already in college for computer science. Why does a tool like this matter so much for public health?
It's about access. Millions of people never get timely diagnosis, especially in places without enough doctors or equipment. Circadian AI could be used at primary health centers, giving frontline workers a way to catch heart disease early. Dr. Jamil Ahmed, an electrophysiologist at LSU, pointed out that diagnosing people who'd never see a specialist could help reduce long-term heart disease rates.
So it's more than just a clever app. It could actually change how countries approach prevention. But there must be obstacles. Regulatory approval comes to mind. What's standing in Siddharth's way right now?
There are quite a few. Every country has its own medical device regulations, so the app needs to meet local standards for accuracy and safety. Then there's data privacy, HIPAA in the US and similar rules elsewhere. The team has to make sure data is transmitted and stored securely, and that patient anonymity is protected before they can launch widely.
And is this something people can use at home, or is it just for clinics?
For now, it's meant for clinical use, screenings in hospitals or primary care centers. It's not a replacement for full diagnostic tests. The team is working on simple, maybe multilingual guides so healthcare workers can use it with minimal training. That's key if you want to scale it in places where resources are tight.
And Nandiala isn't stopping with heart disease. He's already adapting the technology to check for other conditions, lung diseases like pneumonia or fluid in the lungs. The same platform could eventually support broader health checks, all powered by AI.
And it all began with a teenager who wanted to use technology for good. The chief minister of Andhra Pradesh even called him an inspiration. It's a reminder that big ideas can come from anywhere, and age doesn't have to be a limit.
But there are bigger questions too. How do we make sure these tools are used responsibly? How do regulators keep up with new technology like this? And who's accountable if an AI makes a mistake in diagnosis?
Those discussions are only just starting. Right now, Circadian AI shows what happens when young innovators and new technology come together, potentially bringing life-saving care to more people. The technology is ready, but the real challenge is making sure it's safe, accessible, and used wisely.
And that brings us back to where we started. A quick scan on your phone, but with the potential for a huge impact. If more young people take on these big challenges, who knows what we'll see next?
Thanks for joining us as we explored how a teenager's invention could change global heart health and what it might mean for the future of medicine.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.